the best and the brightest from both the Emirates and obviously from the States. But it's my great pleasure to introduce Rick Klausner. Rick is a very old friend, or shall we say a friend of long standing. Rick has formerly served as the director of the National Cancer Institute, where he led one of the world's largest research and health agencies, creating successful national and international programs aimed at applying science and technology to improving public health. He also, following his career at the NCI, Dr. Klausner was executive director, but founded the Bill and Melinda Gates Global Health Program. He also now, having successfully launched that program, is managing partner of the Column Group, a strategy-based venture fund. He serves as advisor to the Prime Ministers of India and Norway and senior advisor for global development to USAID and to Secretary of State Hillary Clinton. That really doesn't represent the breadth and scope of what Rick Klausner does. He is one of the most imaginative and creative thinkers that we have in the healthcare space. Also, my good friend, although I'm not here to introduce Dr. Kurt Newman, but Kurt is a friend also of many in this room, serving as the director of the Sheikh Zayed Institute, and I also serve as vice chairman of our Children's National Medical Center in Washington, D.C., and it is a great honor and privilege for me to be a part of the extraordinary international partnership that we have here with the Emirates. So I can assure you this is going to be a provocative conversation. So Rick and my colleagues, thank you.
Thank you, Tony. That introduction, I can only disappoint, so relax. First of all, I also want to thank the Aspen Institute in Abu Dhabi for this invitation. I have to say, I spend a lot of time not only advising governments, but traveling around the world, hearing and talking about innovation, and it's been very inspiring to be here. It's really very unusual, almost historic, when rarely a political entity is able to articulate a vision and a sense of purpose and a sense of urgency about change, as we're hearing in Abu Dhabi, and so it's really a pleasure being here. In this session we're going to talk about health, and particularly the question of the relationship between innovation and health, and a very complex issue, because health, like education, is part of the fundamental substrate for a successful and certainly a just society. So Abu Dhabi and the Emirates have the challenge of building its health system to fulfill the vision of a healthy, of a just, and a productive society. But in this context of innovation, one needs to ask two things. What does it mean to have an innovative health system? And in what way does having a health system create opportunities for innovation, something we've heard very little about in the various ways that people have talked about innovation of the century we're now in. One of the claims that many make is that this century, in terms of innovation, will be a century of life sciences. And writ large, that may be quite true. The brain is a model for computing. The ability to rethink industrialization, energy, the environment, vis-a-vis our deep understanding of biology, and of course, the fact that health itself, the opportunity and the fulfillment of health, given a world of rapidly changing demographics and rapidly changing and continuously changing definitions, and existences of disease, there will keep being new diseases. There is a new infectious disease that emerges in the human population approximately every year. Health and achieving good health is nothing that is over. It is a continuous journey. So we want to touch on both the question of building a health system as a critical infrastructure for an innovative society. You cannot have an innovative society without dealing with the health of the population. It's a fundamental obligation of a political system, but also to explore what does it mean to build a health system capable of being part of an innovation society. So let me just briefly start with some thoughts about a health system. Let me just describe from my own perspective the 6 components of a health system that one has to aspire to. First of all, it needs to be patient-centered. I won't define that. I suspect our esteemed panel will illuminate that. Secondly, a health system, a medical system, must be part of a public health system that is robust and integrated, that deals with both wellness of the individual and the population as well as disease. Thirdly, it always does and must operate in a regulatory environment that assures quality and accountability and enables the achievement of its aspirations. And I will posit that the development of a regulatory framework offers a global innovation opportunity to Abu Dhabi. Fourth, it is a critical part of the social and economic fiber of a country. Not only all of the expectations and benefits of good health, don't have healthy children, you will not educate them well. And it's really a striking and extraordinary thing. But secondly, on economics, at one level, there is the reduction of the GDP drain by people seeking health care outside of a country, to turning that around to the ability to contribute to GDP. And I'm very impressed with the aspiration in the 2030 vision of the increase of contribution to GDP, not just drain on GDP, of health. Fifth, it requires a robust business and financing model, but that must deal with the intersection of public and private interest and financing. Why is this so? It is so because, perhaps like education, but maybe even more so, health has a social value that is very disconnected from its fiscal and economic value. Also, probably more than any other domain of human endeavor, we have not anywhere that I know of learned how and whether there is such a thing as a truly informed, free choice related consumer when it comes to our own health. We might look towards the educated consumer, but I think there's always a failure there, more so I think than in anything. That requires fundamentally a deep interaction between government and the private sector. And six, a health system which is a manifestation of knowledge and technology only works if it's porous to the world. And porosity, bringing up a theme across everything we've talked about, only works with a world-class workforce. And perhaps we'll talk about what that actually means, how one attracts, but more importantly, retains a world-class workforce in an enterprise that is continuously changing. Underneath what I just said is a bias. If you do not have the opportunity for innovation, for research, and for contributing to the global health web, community, you will not be able to retain a truly world-class workforce. I didn't talk about innovation, and I just want to make 3 comments about innovation before turning this over to our panel to give their thoughts, their experience, and to flesh out these themes. When I think about innovation in healthcare and in health systems, I think about 3 things. One is that a health care system, to be maximally effective and efficient, and by the way, these systems are notoriously inefficient, and secondly, rarely do we have very good measures of efficacy. Interesting. The requirement to get towards efficiency and efficacy is that it has to be a learning system. And that's deeply embedded in the ability to measure and provide what you measure back to all the decision makers so that the system is truly a learning system. That's one. The second is that innovation in a health system involves the process innovation that actually allows the introduction of new technologies. And that itself requires innovation in regulation and these measurement systems. In some sense, I would pose that the ultimate health delivery system, as an innovative system, says that the best healthcare system is where research, clinical research, and patient care are indistinguishable. The best example of that we talked about yesterday when we were talking is the experience of developing cures for pediatric cancers throughout the world, which occurred over the last 50 years with not a single major scientific breakthrough, but rather, which is an amazing thing, but rather because in pediatric oncology in the United States and in Europe, the care of patients, of kids with cancer, became completely embedded in a self-learning research system. Important lesson. And then finally, the innovations of health are embedded in an ecosystem of discovery and innovation that is instantiated, if we would say, I like that word, John, in the biotech, the pharmaceutical, and the vaccine industries. And I would posit that the Emirates have not lost the window of opportunity to really, in a serious way, contribute to the global enterprise of the biotech, pharmaceutical, vaccine, medical device industry, which itself is at a moment of crisis throughout the world, which is a fantastic opportunity for a developing system. So that's the framework I want to put on this. Again, despite the embarrassing introduction of me by Tony, I will not be as gracious to my colleagues because you can read about them. They deserve more. I want to turn to our panel for some comments. And first I'd like to turn to Suhail Al Ansari. And I really, with the work that you're doing, I'd very much like you to share with us what your vision of success is in building a healthcare system in the Emirates. How will you know you're there?
Thank you and good morning. Of course, building on what you said, I think we can get to answering that question. At the end of the day, this is a journey. And the way that we would at least realize the success and in realizing our vision would be when we can recognize that we have contributed towards the establishment of a overall healthcare system. And it's important to emphasize on a healthcare system that is in harmony with everything else going on around us. As Mubadala Healthcare, yes, we do play an important role, being a government-owned entity, creating businesses that are that are based on a private network, doesn't mean that that gives us the right to neglect or work in silo of the public healthcare system. At the end of the day, it's important to work within this one system. So realizing that we can provide world-class care at home, closer to where we live, in partnership with our other partners, stakeholders, neighbors, if you want to call it, is for not only for now, but also being at the forefront of it in the future is what I would believe would realize that vision. But it's important to, I think, go into a bit more granular detail and trying to perhaps put some meat around that. And what does that mean? Well, when it comes to looking at an evolving industry, especially within this part of the world, within a growing economy, within a growing population, we have recognized that there's a need, there is a gap for quality healthcare over here. And a simple metric for that is just by simply looking at the $200, $300, $400 million or so a year that is spent abroad for patient treatment, going out of the country. That is export of GDP. The challenge we face today is that the healthcare contribution to GDP represents less than even 0.5% of the GDP contribution today. If we want to realize on the 2030 plan of Abu Dhabi's, eventually by 2030, we should be targeting a significant improvement of that. In a developed economy, we're talking typically 8 to 12%, if I'm not mistaken. Even if we were to contribute half of that, there's a lot more to do. And to do that, that means pretty much importing some of those dollars going out back to home. What we have learned is that innovation to us at Mubadala in the world of healthcare means the infusion of, or the harmonization of 4 pillars that contribute towards that overall healthcare system. Those 4 pillars that we call our key success factors to any establishment of a healthcare business, particularly to patient care delivery. And I'm going to focus on patient care delivery because that is an area that we have some experience in and have had the opportunity to learn within the spectrum from. And it is what we believe is the immediate needs to cater to a growing population. Those 4 pillars that I mentioned is a unique business model that allows the partnerships that are involved in any business to flourish and to succeed and be sustainable. And I'll get into the details of that. It's, of course, touching on something you mentioned earlier, Rick, which is patient experience, building a very robust and patient-centric model that caters to the needs of a patient rather than the classic old-fashioned way of building businesses around a doctor or a physician. At the end of the day, it's the patient that makes or breaks this venture. A care delivery model that is based on transparent data, transparent information that empowers the patient to decide, choose, and learn about what it takes to receive the best medical care that one would expect. And the 4th pillar being technological innovation. How do you use technology to take this to the next level? In order for us to realize innovation, there are certain fundamentals that need to be in place. And I believe today we're probably at the phase of putting those fundamentals in place, which is why we focused on building this patient services businesses on ground. Going back to the first pillar of the business model, what we've learned that has been successful is creating a partnership with world-class medical institutions, with the likes of the Cleveland Clinic, with the likes of Johns Hopkins, whether it be the Imperial College of London, all in the same, very similar manner. Allowing these institutions to do what they do best and complementing them with what we do best. As an investment and development company, we're great at deploying capital. We're great at setting up businesses. We're great with our local knowledge. But in all honesty, we don't have the slightest clue about what it takes to treat a patient. We are not clinical experts. That's why we complement with these institutions, with one another. Business model we have to date realized as successful have been those that have been whereby Mubadala deploys the capital as a 100% equity holder of the businesses, but partners through long-term management and operations agreements with these partners that gives a sense of ownership and aligns the interests of the 2 parties with one another, not burdening one another with trying to figure out how to do something that they're not best at, but rather bringing the best of the best minds together and establishing a successful partnership model. But with a caveat, that successful business model, that when you import knowledge, the caveat should be that that knowledge is eventually over not 1, 2, 3, but probably 5, 10, 15 years or so, that knowledge is transferred to a more regional and local community. And that learning that you touched upon then comes into play. At the end of the day, what is innovative in this piece is the fact that we've learned how to create business models that also meet our double bottom line. And that being is that, number one, every venture that we've deployed capital towards has been proven to be financially sustainable, and they have to be that way. At the end of the day, our shareholder expects returns on that investment. But more importantly, we've contributed on a socioeconomic level too. I mean, at the end of the day, if we're managing to treat patients that would otherwise have gone abroad, automatically we're realizing that return in a very tangible manner. More importantly, we're giving good access, easy access to good healthcare to the population of the United Arab Emirates and hopefully the wider region, whether it be the GCC or the MENA. Going to the next pillar, patient experience. I think that is something that we've learned primarily from our partners at the Cleveland Clinic. The Cleveland Clinic has been referred to by President Obama as an optimal healthcare model and practice, and something that we're very, very proud of, an institution that we're very proud of to have partnered with. The main reason, and the core of which is, and the reason being that the entire the entire business model is centered around the experience of a patient. The patient, day by day, becomes, we've realized, more and more sophisticated, educated, and has higher expectations in terms of receiving the medical treatment and care that when they walk and choose into the facilities that they do come. We're fortunate to have a very visionary leadership whereby a few years ago, mandatory employer health insurance was introduced over here, which meant there's more decision-making power in the hands of the patients, creating natural competition over here. By building a very unique patient experience model within every business, we've learned is we've managed to attract the patients that would not only, without a doubt, expect an excellent level of clinical care, but would also expect good patient care, good customer service. From the minute they pick up that telephone and calling these institutions asking for an appointment, all the way through to receiving the care, through to leaving, the follow-up, even being educated on how to prevent themselves from becoming sick in the future, rather than becoming ill and walking into the center, which is somewhat contradictory to the good of our business, but at the end it's developing a healthier population, is something that has worked. A key example is one that we've built in an operating asset already. Our diabetes center that we've established with the Imperial College of London was designed in its physical sense, from its patient flow model to its customer service model to its IT system that has been established all around the patient. When a patient walks into the center, they go through a very seamless and quick process of being screened, diagnosed, receiving their medication, getting some basic education about their well-being to pass and transfer to their families, and walk out knowing what the next steps are. And that was then monitored on an ongoing basis. Just to give you an example of what I mean by a success factor around the patient experience is that a diabetic patient goes through several sessions with several specialists. It's a multidisciplinary model that we've based on this. Diabetic patient can have eye issues, heart problems, digestive issues, foot problems, you name it. So within our center, we have multiple doctors available. At the point in which the diabetic patient comes in and is seen by the general practitioner and then moved along the chain to meet with these specialists, the process is so optimized that there is less than a 2-minute waiting time at more than 70% of the time from station to station. Unlike the classic model of where one would have to go to a hospital, meet with a GP, then be referred, and this process could have taken sometimes a matter of a couple of weeks to take place. with an in-house lab, an IT system that allows for paperless transfer of that medical record from physician to physician within one institution, has allowed for that optimal patient experience. I'm proud to say that we've achieved above a 90% patient satisfaction model, however you cut and dissect it. But more importantly, we've managed to empower the patient with all the information that they need so they can decide what the best course of action is.
It's 2-minute turnaround time. Would you allow us to sign up? Is it,
Absolutely, we'd be happy to. The third pillar is the care delivery model. At the end of the day, we partner with the best of the breed, best in the best from around the world. American partners, British partners, Asian partners, you name it, from all over the world. We have a very unique opportunity in bringing the best of minds around one table and have them contribute towards ideas sharing, knowledge sharing, and identifying what the cutting edge ways of treating illnesses and diseases are, and then taking that one step further, how to manage chronic diseases in the longer run. Not only trying to find out how to manage a diabetic patient day one, but how to manage this entire diabetic phenomena that exists over here. 1 in 4 of our population suffer from this. So we do have somewhat of a sick population, and we need to address that. And I think my colleague from the Health Authority would make some interesting comments on this later on. But excellence in medical practice, so bringing in the world's best to bring best practice into this country altogether, not only to bring in the American system or the British system, but a global best practice system to one place, is the opportunity that I believe we've created for ourselves today. Going forward, that means that allows us to tap into the research capabilities of these institutions, so that not only can we attract human talent, which is a huge challenge for us over here. Yes, we can talk about building 60, 70, a million institutions within the country if needed. But without the software, without the human capital, none of these would be successful. And already a challenge globally, attracting medical professionals into their home base is an issue. It becomes exponentially more difficult attracting them here. Yes, we're fortunate to be in an environment that allows for opportunity for ambitious individuals to come in here, but we also have access, we do have access to housing them in an infrastructure that is world-class. But what we believe is going to take beyond good salaries and a nice living environment to attract these knowledge and talented, knowledge-based and talented individuals. Having the opportunity to conduct research, learn, and tap into the global educational web, if you want to call it, is something that is critical to keep and sustain them. Again, I refer to our partnerships with the Cleveland Clinic or with our Imperial College at the Diabetes Center, simply because these are great examples of successful partnerships that we've established. Is that we've managed to attract these top-notch individuals from outside of the region to want to call Abu Dhabi a home, to want to bring their families, to put their children into the schools over here and want to be here in the long run. And the way we've done so is not only by giving them opportunity to work in world-class institutions with globally recognized partners, but at the same time the opportunity to tap into research going down the line. I mean, think about it. 1 in 4 diabetics, the amount of data that we can capture from this and the value of that data in which research can be conducted is priceless. Yeah. And it puts us in an opportunity.
Exactly. And it gets to this whole issue about world-class workforce that we talked about in several sessions.
Yes. That's absolutely correct. And not to take more of a limited time, but I believe the fourth pillar is extremely important to recognize here, which is technological innovation. That using technology to allow us to apply innovation in many ways. By building the fundamentals in many shapes and forms that I have talked about for the past few minutes, allows us the opportunity to have access to information, to data. So having a unified electronic medical record system, which the leadership of the country has been very forward-thinking and mandating, which we have followed, allows us to capture data in a manner in which we can utilize that data through a technological, through technology, and conduct research and apply that technology on a day-to-day basis. So the opportunity not only to have world-class best practice today, but also discover better ways of treatment down the line is an opportunity that we have in our hands today. But in all honesty, I don't believe that we have had the opportunity to take advantage of that yet, simply due to the fact that we've been busy building those pieces of the pie.
I think maybe we'll come back to that.
Sure.
Thank you very much, Suhail.
Thank you.
I'd like to turn now to Dr. B.R. Shetty, very well known in this area for his extraordinary contributions to medicine and philanthropy. And I particularly would like to hear your description of, in essence, the role of the private sector in achieving the social goals of health with a successful private model.
Thank you very much, my dear friends. I first of all thank Excellency Yusuf Oteba for giving this good platform. These 2 days, sir, given us well education, good education, and also I pray God Almighty Allah that our father of the nation, it was his vision that health and education should be affordable at affordable quality. Health and education should be affordable at affordable price to everybody. This is the model I kept. From there, I have worked as a backward integration. When I came here 36 years ago, I came 39 years ago. 36 years back, I heard this. Immediately, I just took an opportunity. At that time, everything was free by the benevolence of then ruler. One could come here, get the heart operated, take the medicine for 1 year, stop. No charges being levied. Everything was free. And that was the time we just thought we'll make a small dent by giving extra service and charge little fee. That's how we started. At that time, no private sector in the country, not only Abu Dhabi, in the country. We are the first one to start the private sector in Abu Dhabi. Thanks to the rulers and the royal family that they encouraged me. They couldn't believe we had a very good laboratory. Then they were taking this laboratory report to Cleveland and Mayo Clinic. And they say, very good laboratory report. That's how the confidence is built. That confidence has made us invigorated us to improve further. One flat clinic, now we have got 11-storied hospital, 11 buildings is spread. One of the hospitals in Abu Dhabi, 3 hospitals in Abu Dhabi, it's highly sophisticated, JCI accredited, then Align one very good hospital, Dubai 3 hospitals, Fujairah 1 hospital, a good networking is built in this country. So thereby total number is 9 hospitals altogether so far. And as a backward integration, we have developed a pharma factory, pharmaceutical industry, where we, as you rightly pointed out, for the cancer, we are partnering with Abrexis laboratory from USA. We brought out one product, biotech product known as Abrexin for the breast cancer. It is being used in Defense Hospital, in Khalifa Hospital, Sheikh Khalifa Hospital, everywhere. And it's one of the innovative products of ours. Then also in the pharma, it's a high-tech generic pharmaceuticals with the collaboration with the Pfizer and also Avantis and technical know-how. And also we have recently allowed to manufacture Tamiflu. They are the only one in the Gulf. And this is why I'm telling you, you said Abu Dhabi you should encourage. So that's where we have encouraged, made a very good progress in the industries also. In addition to that, nanotechnology we started by the collaboration of Arkansas University, sir. And that's where in the watch you will have a chip sensor which makes the sugar level. It's under innovation, it's ready now almost. I asked them, can I announce it? He said, yes, Shetty, announce it. No problem. Arkansas, Dr. Yasser Gill, under his Yasser Gill, Dr. Yasser Gill, and also Dr. Vardhan. These 2 people have done. It's Clinton's university, and it's all getting ready. Our building is also, expansion program is ready, and once it is, our incubator is there already, it will be patented from Abu Dhabi. This particular device will be patented from Abu Dhabi. That's why we are working on it, because we are basically Abu Dhabian. Abu Dhabi 2030 program is there in every blood cell. So that's why we are progressing very well. And it's a good networking. And we have got nearly 600 doctors altogether in the country, with 3,000 patients average per day, which is being served very well. But only thing is infrastructure is not that good. Thanks to the health authority, now they have given us very good land in Sheikh Khalifa city, and which we will be building of the world class. What Excellency said, that you don't want to go more abroad, you will be here. Hopefully, we will cater all these services in our hospital, new hospital, which will be ready in the 2.5 years' time.
That's fantastic. Well, thank you very much. Let me turn to Dr. Kurt Newman, an old friend of mine. We went to medical school together and haven't seen him for a long time. Kurt is the Vice President and Surgeon-in-Chief of Children's National Medical Center and is also at the Sheikh Zayed Institute for Pediatric Surgical Innovation. And Kurt, I'd like to ask you particularly to talk about this issue of porosity and the incredible importance of technology transfer, but again, your vision about how will you know if that's successful? How are you aligning the needs of your institution with the aspirations of the Emirates through this interaction?
Thank you, Rick. First of all, thank you, Ambassador, and also to the Aspen Institute for giving me the opportunity to be here with you all. And certainly I'm learning much more than I'll be able to share. But I did want to tell a story, and it's a graphic example, I think, of innovation and what can happen when partnerships develop. And part of it's a personal story, and part of it's a story about institutions and friendships. So I'm a pediatric surgeon, which means I operate on children, and I've been doing that really since Rick and I were in medical school for over 20 years. And now I'm at the Children's National Medical Center in Washington, D.C., where Tony Verstandig is our vice chairman of our board. And it's a large children's hospital, very good children's hospital in Washington. And so I've been facing the issues of taking care of children one at a time and seeing the issues that they deal with and families deal with as you care for them. And maybe it seems mundane, but it's the problems of big operations, small children, pain, big incisions, and the field, there was progress, but it just never seemed to be making the kind of quantum leaps of progress that I would read about when people were decoding the genome or doing all these other things. And a friend of our hospital, a friend of mine, a friend of the ambassadors, Joe Robert, and I'd operated on his son, challenged me, and he said one day, why can't you just do something very different? Why can't you just look at how you want a child to be at the end of an operation and figure out ways to make that experience better? And that was a very different way of thinking than we usually think about in science and medicine. Usually it's very incremental. It's a little step here. We're safe. We want to get funded. We want to do things that have a big chance of success. It's not taking big leaps, and we heard a lot yesterday about the freedom to fail. It's not that kind of a culture. So Joe, in his great wisdom, was challenging me to think very differently, to think innovatively. And we put a proposal together, and it was big ideas. I mean, really big ideas. Eliminating pain, making surgery more precise and less invasive, really changing the whole experience of surgery and an operation for children. And Joe loved this idea, and he knew there was really only one place in the world where people were thinking along these ways, where there were big ideas, where there was this culture of innovation, where people would embrace this kind of thinking and this type of advance and this type of innovation. And in his great way of networking, he introduced us to Abu Dhabi at Children's National. And through a series of meetings and friendships and education, we developed a partnership, a joint effort to develop an institute where we would tackle the problems that I mentioned. And it was a shared vision, and the resources from the Health Authority of Abu Dhabi and the government of Abu Dhabi, along with Children's National, to create this institute, and we're doing that now. And we're building this institute on the campus of Children's National. And it's exciting, and we're using all the principles of innovation that we've heard about. There's a sense of urgency. We've got to get this done. We want to do that. And it's attracting the best talent from around the world. As we've heard about, people want to make a difference. And they want to have this opportunity of freedom, of some resources, of an opportunity to take some shots. We're not sure what's going to work, but they're going to take some shots and change the paradigm. And I just want to tell a couple of stories about that, because we have surgeons and anesthesiologists and genetic researchers, basic sciences, and engineers working side by side. These are not disciplines that ordinarily work side by side. They work in narrow areas on their own problems. But we brought them together, we're turning them loose, and you guys figure it out. So let's take the problem of pain in children. One of the issues there, it's not a big market. So companies don't think about it, the NIH doesn't think about it. Despite all the great progress of, as Rick mentioned, cancer in children, there's not a lot of great stories about children because it's a small market. It's not something of a place that people like to play. But it's interesting in pain. And if you think about it, adults can tell you when they're hurting or when they're pain, and you give them some pills or medications, and the pain goes away. But nobody really thinks about children. So our team thought about this and said, well, you know what? The reason is you can't ask a child if they're in pain. You need a way to measure it. And that was the breakthrough. There was no technology to measure pain in children or in people. So they've developed this technology. They've applied for a patent. And once you can objectively measure pain, you can study it. You can create new drugs. You can look at the genetics because you have an objective measure of pain. And it's totally changed the paradigm. And now it's going to change the way we deal with pain in adults, and it's created a new market. That's innovation. A second one, surgery. So most surgery, the surgeons have to deal with tools that frequently are developed for other reasons, robots, or the human factors are not involved in that. So it's what we've done in putting the engineers together with the surgeons. It also came up that the best people at dealing with these inadequate tools are the young people, because they're used to the video games. So why not get gaming technology with the surgeons, with the engineers, so that you recreate how the tools are created? And this thing is just totally taking off. And, you know, I don't know if it's going to be FIFA or Halo or whatever, but I can just see the video games that these guys are going to create that are going to be teaching surgeons or simulating surgery. And that's the kind of thing that's going on in the Sheikh Zayed Institute for Pediatric Surgical Innovation. So you can then ask yourself, well, this is taking place on the campus over in Washington. What's the benefit to Abu Dhabi? Well, I think in their great wisdom, the government of Abu Dhabi and its leadership saw that to move the medical system forward, they need to bring this type of innovation and thinking in. And what better way than to align itself with a situation like this? So that we'll be bringing people from Abu Dhabi to the Sheikh Zayed campus. We will be beginning to teach people how to do research. We will be able to diffuse the discoveries that we're making rapidly into the health system here. And believe me, I think that's a big benefit, as Suhail mentioned, is to have a system that has an electronic medical record for every single one of its citizens that tracks it all the way through from birth to death, that really can look at outcomes, that is interested in innovation and embracing new technologies and putting that into their health system. I just wanted to tell a story, and I'm just going to tell this story because I had an opportunity several months ago to share with Sheikh Mohammed the progress that we were making with this institute. And I think it just really goes to be successful at something like this does take leadership, and we heard about it yesterday about when the ambassador was talking about the pearl industry and how we need to understand history. And I think it's interesting here because Sheikh Mohammed told me a story about his father, which was that I believe it was in his hometown there was a very high mortality. And many of the women died in childbirth, and many of the babies died right after they were born or early on. So a couple came to town, two missionaries, husband and wife, came to town, and they were talking about building a clinic there. And the elders in the area came to Sheikh Zayed and said, you know, really we shouldn't build this clinic because they will want to build a church, and they will want to convert the people. And Sheikh Zayed apparently took the advice under consideration, but then, over the objections of his advisors, decided to meet with the couple. And the couple made their case and said that they wanted to build a clinic. And Sheikh Zayed said, is there something more? And the couple said, yes, we'd like to build a church. And apparently Sheikh Zayed thought about that, and then said, okay, well, you can build the clinic in my house. You can have my house for your clinic, and I will build you the church. And he saw that for his people, the importance of health care and to endorse that. And I think it's that great vision, being able to see beyond the horizon, typifies this country, and is why we're so thrilled to be a partner in something like the Sheikh Zayed Institute for Pediatric Surgical Innovation. So thank you.
Well, thank you, Kurt. That was fantastic. Maybe I just point out that there is a difference, it seems to me, between being open to technology transfer, things that are developed elsewhere that then you are open to importing, from sharing, as you're describing, a culture of innovation, which one will need both. But I think it's going to be very interesting to come back and talk about the difference between tech transfer and an intrinsic innovation culture that, of course, relates to what you said, and that is, each area's medical needs share similarities, but is diabetes the same here? What do we learn from it? There's so much we don't understand about the mystery of the local epidemic of diabetes, et cetera, that, I think the culture of innovation that you're talking about is going to be very important for a successful medical system. But all of these systems are going to depend upon having the facts and being able to measure things. And it's a great pleasure to introduce to you, someone you know, Dr. Finn Goldner, who is the Director of the Health System Financing, the Health Authority of Abu Dhabi, who hopefully will share with us his thoughts about what they're doing and why that will be a fundamental substrate for health and innovation.
Thank you very much, Rick, for the introduction. Thank you very much, Your Excellency. Ladies and gentlemen, it's a great honor and privilege to be sitting here, but it's an even greater an honor and privilege to actually having contributed and being allowed to actually help along the fantastic journey that Abu Dhabi has undertaken with, I think, some measurable success that I'm happy to talk about. Otherwise, it's a bit difficult after, being the last in row to say something new. I will try nonetheless and kind of try to align it with what we're trying to do at the Health Authority. First of all, I think it's very important, as Rick said, to have an articulated vision and know what you want to do. We're very proud at the Health Authority to have had a vision which has been stable for the last 4 years, in which we have undertaken this rather ambitious reform project, and that vision centers around all the things that we've talked about. I think from a customer perspective, first of all, the decisions that you make around a just system, we said affordable access. That means that people actually do have access to healthcare on both dimensions, both on the financial risk protection as well as on, of course, the capacity side of things, that there are actually facilities available. The second part, very importantly, and you can spin it one way or the other, is customer satisfaction, patient responsiveness. And that is very, very important, because that's what people feel when they go and consume healthcare services. But it's even more important in a place like the United Arab Emirates, with its specific demographic makeup and economic situation, because most people have a choice to consume their healthcare services elsewhere. So making sure that they're happy and gain the trust in the system is very, very central. And the third one is, of course, the most difficult one, and that is we do want to improve health, because as Suhail and some of you mentioned, there are some serious problems in public health that we do need to address with the population going forward. And then it has two financial dimensions. One of them is, of course, we want to carefully watch the cost over time, because health always, as much as it is a contribution to GDP, is of course oftentimes also a contingent fiscal liability, so we want to know actually what it is. And the second one, and also we've been having a great discussion, is of course saying we do want to encourage private sector investment. Why do we want to encourage private sector investment? I think, again, it has something to do with two things. One of them is the porosity, as you call it, getting in stuff from elsewhere, because in Abu Dhabi it would be very unlikely that we invent everything. Most of the stuff is invented elsewhere. But secondly, also because it's really a litmus test for that, the previous 2 points, and that is, do people trust us enough to actually put money on the table and come here and want to come here? With that said, and having summarized a little bit of the vision, what have we actually done at the Health Authority, is primarily 3 things. The first one, also referring to what Rick said about regulation, and it's a better time to talk about regulation than 4 years ago when I came here. It's become more fashionable to talk about regulation as a competitive advantage, is something that is new in the region. We created a pure regulator. We spun off all operating assets into a separate healthcare provision company, which is called SAHA, to make sure that the regulator really can focus on setting the regulatory framework and inspect and ensure quality. The second one is indeed taking in international private partners into managing some of our assets on the provider side. We've heard about Cleveland Clinic, we've heard about some of the other partnerships, but also on the payer side. And I will talk about that, because that's the third cornerstone, which I think nicely leads over to that topic of innovation and how we think about innovation. And that is that we've said part of our vision is that we do want a system that finances itself through insurance, and that allows for a degree of subsidy, but that degree of subsidy should be efficiently managed. So kind of, that public-private bond. Why did we choose insurance, and what have we done about insurance? I'm very, very proud to say that we have, in a very short time frame, ensured universal health coverage. Everyone in the Emirate of Abu Dhabi has health insurance, mandatory health insurance, paid for the expatriates by their employer, paid for by the Department of Finance for the locals, and that's 100%. Everybody, Arabic, English newspapers, you've seen the lines of people that are coming to the Health Authority to pay their last fines for non-renewal. Actually, it is, we have 2.3 million insurance contracts in Abu Dhabi with a population that's probably around 1.92. Some people have double insurance, so we don't know exactly what it is. We know it's over 99%, because by now the insurance data is actually better than the census data. So that is something which in itself, from a pure access point of view, is actually a great achievement. But why did we choose insurance? There's many other ways that you can organize yourself. And the first reason is that insurance provides a lot of data. it does provide a lot of data that we do need for all of the other things, and that is to actually, when we talk about quality, what do we mean by quality? We do need to measure quality. If we do want to be a regulator that is informed, how do we turn around that information asymmetry that usually people don't like to just report to the regulator? And I'm going to tell you in a little bit what we've done there. But then, of course, that's the third point, and that is the real innovative side. You can do something with the data, right? You can think about incentives. You can think about payment systems. You can think about risk transfer, disease management. You can think about new models of actually business, right? You can actually structure business models around the use of information. And if we, from a health authority, pure regulatory point of view, should talk about, leaving aside the fact that, of course, insurance uncovers demand, and Dr. Shetty has been the beneficiary because he has been very successfully treating everybody, including the poorest in the basic product, who have the white card, which is a government-subsidized product in his facilities. But also, of course, Mubadala with all their great new facilities. So. But what is it really about that information that is so important? Well, it is so important because we do have a population which is not only young and growing, but it's also young and growing and relatively sick for its young age. So the median age is 19 years. The rate of diabetes is around 20%. We always say the second highest in the world, but that's not because Kuwait has a lower one. It's just because we're the first ones who have actually measured it with the whole population. When we introduced the THICA program, which is the health insurance program for the locals, we thought this is a unique chance, shaking hands with everybody in the population, everybody, period. We should use that opportunity to actually get some information, do a screening for basically cardiovascular and metabolic risk factors. So we have a database which includes the complete set of those risk factors for not a sample of the population, but the total adult population. The other thing which we have done with the health insurance system is we have transferred everything to pure electronic claims, which necessitated going through, and that's also a good example for porosity, which necessitates, first of all, agreeing on standards, just like in banking when you use your ATM machine all over the world. You need to have two types of standards. First of all, in medicine, you need to have clinical coding standards, so you need to agree about what clinical language you speak, but then you also need to talk about what kind of transaction set exchange technical language you speak, and we think that that is actually where the regulatory function is, in setting those standards, mandating those standards, but being system agnostic so that everybody can choose their own IT systems, but making sure that the information is available, not only for the health authority. I've brought the book, but we're actually working on making that raw data in de-identified form available to everybody else. That's the innovative space. We're making that data available for people to use it. And I think that's the last thing I'm going to say, and then take it from there. Why is that important, and how does it relate to the other difficult questions around research and retention and human capital and everything? And it relates to some of the points we've also heard yesterday in the lecture and in the Majlis and the early morning sessions. It's unlikely to recreate a basic science campus here that immediately will be able to compete with the best in the world. But data is wonderful. Data travels and is open to collaborations. Many people have come to us and have said, this is wonderful data from the pharmaceutical industry to research organizations, and we can actually make sure that in that sense we use the clinically, the applied data for actually fostering research, which I would 150% agree is a total necessary prerequisite for actually retaining top medical talent, because they do want to do research. They don't want their career to be on hold while they're in the UAE. They want their career to progress. That's for the expatriate side, which will solve a lot of the problems if we can decrease churn, increase retention. The real problem, and that is a real problem if you look at the numbers, is of course to also make sure that we localize the workforce, the clinical workforce, nurses, doctors, and make sure that we drive the Emiratization program hard. Because I think it is a total prerequisite for sustainability. It has many other aspects from security concerns to all others, and that of course starts a bit early, and that's why we get into the morning session and education and things to do about it. But that's why I think it's also very important to carefully balance that that public-private sector mix. So what we have done for the public sector hospitals, the Saha hospitals, is we have said, basically we want you to get away from a block funding model. We want you to be more revenue-based in your financing. So please, every activity that you can bill, please bill to the insurance company. There are some other things that you're also doing, like, for instance, employing more locals in the private sector, which we encourage you to do, which we pay you to do. But there's a little bit left over that is inefficiency, and we want you to please do away with that, because that relates to the vision. Yes, indeed, we do want, and we don't object to public sector, and we don't object to subsidy, but we want it to be efficiently managed. You can only do that with data again. That's kind of a short view as to what we've been up to at the Health Authority. Again, in great partnership, and it's when you talk about competitive advantages and why Abu Dhabi is a special place, it's a special place because you're allowed to have big ideas, but then, of course, also work on the hard little baby steps in implementing them. But you do that not only with a wise and informed leadership, but also in a very cooperative manner.
That's great. Let me pick up on a point that was made yesterday, and I was really struck with it in the education session, and that is that in listening to both the viewpoint from NYU and Babson, there's a real sense of not coming here to do good, but rather coming here to fulfill your own aspirations. And so it's not just porosity where you can extract the value of the world, the rest of the medical world, into Abu Dhabi, but how does Abu Dhabi create value for the rest of the world? And let me just posit something. And again, it relates to perhaps what Elliot referred to about looking at education system in the United States. There's some terrific aspects, but there's some broken aspects. As someone who's been involved with medical research from early gene cloning and the Human Genome Program, et cetera, I've concluded that the regulatory system in both Europe and the United States, I know the United States better, is fundamentally now incompatible with transforming to personalized medicine, with transforming medicine based upon the science and the scientific potential. And in fact, the brokenness of it means that for pharmaceutical companies, developing a drug is predicting what's going to get through the regulator, not what's going to benefit patients. And in fact, we have very little evidence that there's significant benefit to a lot of the new medications. This is a fundamental regulatory problem. I'm not sure it's going to be fixed. A lot of us talk about it in the United States. So as someone who feels that I'm part of the global biomedical research community, I see an opportunity, wherever it is, but because of the vision here, and I'd like you to comment on it, to think about a very special role that Abu Dhabi and this region might have in terms of the fact that it has the possibility of being a place, a region, that can be engaged with the global discovery enterprise, not to replace global discovery, but to engage with it such that the new ways that we're going to demonstrate whether a new intervention is effective or not, which I see as being more and more difficult, would that be something that would drive the way you think about regulation, the design of clinical trials, what determines a successful clinical trial? Can you do a one-patient clinical trial, which I believe you can do with new molecular-based medicine, but is completely unavailable with the current regulatory framework outside? I just sort of pose this and would like your response to it, because I see this as an extraordinary global opportunity for Abu Dhabi to contribute in value creation and to accrue then the benefits of that value creation that the rest of the world, I think, right now is struggling with. So, but for that to work, it means that the regulatory system has to be informed by goals of research, of introducing new innovations, et cetera. And secondly, it requires an understanding of whether the population, to think about this, does your population trust the authorities, drug companies, potential enterprises, that they actually want to be part of a system that is this type of innovation, self-learning system. Those are two aspects I wonder if any of you would comment on, perhaps about where you see the regulatory system going and the openness to the population to things like clinical trials and new technologies.
Sure. I can take a stab at this. We're very fortunate to be in an environment where, especially from a regulatory perspective, and not to speak on your behalf, but experience says, and the very close collaboration that we have had with our colleagues at the Health Authority has demonstrated to us that, first of all, we don't have legacy in the system. We have an opportunity to pretty much do things from scratch. Of course, don't reinvent the wheel and follow some of the best practices from abroad, but also we've realized that by close collaboration, close coordination on a daily basis almost with our partners at the Health Authority on areas that are forward thinking has allowed for this openness to flexibility. And as long as the regulator has that open communication with the community, both public and private sector, I believe it just allows for Abu Dhabi to take advantage of the opportunity to be active in areas that would otherwise not be so, as you alluded to, in the US and Europe. Of course, there are subjects of ethics to talk about, et cetera, and of course tradition, because I don't believe our population is used to being actively involved in things like clinical research. But at the end of the day, it boils down to time. I mean, trust takes time to build.
Yes.
And by delivering on the ambitions of the various individuals that have been talking around this table, and supporting that with a regulatory framework that is continuously evolving and moving upwards in terms of its standards and quality, I believe that we can build that trust in our population, and over time to become more active and take an opportunity on how much good we can do, not only for our population, but then share that knowledge with the rest of the world. Again, not to belabor the point on diabetes, but that's one opportunity. Cardiovascular, orthopedics, so on and so forth. All are opportunities, but I can't say enough on at least behalf of our group at Mubadala that the open dialogue and the openness to doing things in a very different way has been demonstrated to us at the Health Authority. As long as that's there, I think we live in a very healthy environment to take advantage of those opportunities.
Very impressive. If maybe I realize that time gets away from us with these interesting comments, I'd like to open this up for questions from the audience. Sir.
Thank you. I think it's three main key factors important for the sustainable development in every nation. For instance, and the Emirates would like to encourage investors to come, or people that come to work in the Emirates. The first thing they ask about the quality of education, health service, and security. I think in education, just today, this morning, I mean, we've seen we have a good universities, good education system, and accredited universities. So we start having now students, they come from the region, they come from Gulf countries, they come from Asia, they come from Africa to study in UAE, becoming our hub of education system. Security, thank God, I think we do have very good security system. The Emirate people, they sleep in security, they leave their doors open, cars on the street. So that's why this is one of the main elements. I think health services should be also one of the things. Sometimes when we go recruit our staff in the United States or in Canada or in Australia, first thing they ask about it was quality of the health service you have in the Emirates in order to come and to work. That's why I think we need also to have very good health services can compete with the international standards and to raise the health services to international same like we did in the education system. Rather than sending most of the people, they go for treatment to Germany, they go to the States, they go to Bangkok. We spend a lot of money on those people. So why don't we make Emirates also as a hub of health services? We support our health institutions, private sector and government sectors. We support them because this will be a good thing for us to sustain our development. And the same thing also, we need to have partnership with the education system because education system can work on research and can produce innovations from people that they can work also on the service. Thank you.
Thank you. Yes.
I have a question about the research. I think research is the cornerstone of innovation in healthcare. Now, one of the fundamental issues with research is funding. Now, in a lot of places in the world, in Europe and maybe in the US, companies are incentivized to do research with tax breaks and stuff like that. Now, we live in a tax-free society. Funding is an issue. Given that research, you do maybe 10, 20 trials, and one of them would succeed. There's a lot of risk there. The research that's been done right now is on a very, very low level because people are playing it safe. They just don't want to lose money, and that's understandable. Now, is there a role for the health authorities, for example, and maybe Dr. Finn can comment on that, in aiding in providing this kind of funding for credible research and credible companies who are willing to do that, willing to take that risk?
I'd be happy to try to give you an answer on that. Again, it's been pointed out, and I think it's shared by everybody that research is central. I think what we need to establish, and we're in the process of that, is actually a research funding agency similar to, whatever the Max Planck Societies, the National Institutes of Health, some place where scientists in a peer-reviewed manner look at proposals and have access to funding on a systematic basis, not on, every once in a while you fund something here and then you fund something there, but a program. What role does the health authority has to play in there? I think it shouldn't be the health authority. I think there's probably going to be the person from public health who's going to be sitting on the, on the research council's board. But I think the idea for the regulator is really to be very cognizant also of not expanding its role beyond what it should do. And what it should really do is it should regulate and not provide research funding. Research funding, in my view, is a different function. But yes, it is very important that such research funding mechanism is being established, and yes, we're working on it.
Sorry. Yesterday, somebody, I think it was His Excellency Walid Al-Mukarrab, who might have said that Abu Dhabi has very deliberately decided to invest in those sectors and areas that are profitable. And on the flip side, and I think that you alluded to this earlier, that innovation can be measured at least as much by the social value that's created in addition to the financial and the fiscal and economic value. And so it seems, particularly in this area, that optimizing profitability may not necessarily be compatible, or it's not mutually exclusive, but not compatible with optimizing patient care. So I'm wondering if you might be able to speak a little bit more about, in this particular area, how you deal with that tension and how we might be able to do something very different than what we have in the United States.
Sure.
Well, again, Suhail knows that, especially if you go into that healthcare service space, there are actually very, very profitable and very value accretive business models, okay? That's why we like it very much. If we talk about e-claims and data and all the boring stuff, we have created a local industry of IT and service-associated third-party administration businesses, IT implementers that are actually doing very, very well, and there are truly, truly, truly local, not internationally partnered. So you create industries. I think if you look at the payer side of things, again, amazing things happen. And actually, picking up on what Rick said about what is it that Abu Dhabi can actually export to the world, right? Not only have we established a national health insurance company that has grown to now insure over I think around 2 million people, but it's been profitable almost from the very beginning and has now become a center of excellence within the Munich Re Group, which actually decided to become more than a managing partner, but an equity stakeholder to now actually export that very model as to, how to figure out how to do public-private sector partnerships in the payer space to the rest of the Middle East. So I believe there are very profitable models. I think if you go to the pure provider space, yes, indeed, there are many things that are not so profitable that you still need to provide, and that's where the public sector plays a very, very important role. Will you ever be able to have spectacularly profitable NICUs? Probably nowhere in the world, correct? I don't know. There are some areas that are difficult that you do need to continue funding, but I wouldn't say that healthcare is actually in a sweet spot, that it's both, measurable economic, returns way beyond healthcare, positive externalities, profitable business models, and people actually like health.
Yeah, and there's a growing need. Sorry, keep it in order. You?
I'm Ken Wilson. I'm the director of the National Research Foundation here in the UAE, which is a funding agency that uses competitive standards for awarding grants. And we have a pipeline of proposals waiting for funding. And that's a separate question. But I want to take up the comment that was made here about the importance of research for innovation, but more generally beyond health. And secondly, I would like you each to consider the issue of the top-down versus bottom-up. Yesterday there was considerable discussion about the desire or the need to drive R&D from the top down, but often some of the great innovations occur because good ideas come from the bottom up. And in the area of health, I think this is probably one area where you have to have the balance right. Yes, you have some challenges in here that are unique to the UAE in a sense, but they're also part of global challenges. So you can drive from the top down and it has a bigger impact outside the country. But there are also there's real talent here in the country beavering away in various places that needs to be nurtured as well. So I'd ask you to reflect on that in terms of help.
Thank you. Mustafa Karkuti, Higher College of Technology. Really question to Mubadala and Health Authority. Yeah, you touch on Emiratization a little bit, but I would like you to elaborate a little bit on that. But also, Mubadala, if you have really any vision or plans to establish a national health base in a way that's homegrown, that is, whether you have data, an estimate, of course, for the next 10 years, 15 years, how many nurses you expect from the nationals to join the system, how many doctors, how many surgeons. Do you have such figures for the future?
The honest answer is it's something that we're certainly serious about and working on. I wish I could tell you we have exact figures, and I wish we could also say that it was easy to have an Emiratization target of 50% in the healthcare sector. The fact remains, however, we are very limited in our local human talent, which I think is relevant in not just healthcare, but some of the other sophisticated, very specific new clusters that are upcoming here. But the way we're addressing this is simply put, is by establishing these institutions with the global partners that we bring and communicating that to our younger generation of Emiratis, that the healthcare industry is a place you can have a career in. I mean, at the end of the day, just by looking at some of the numbers, we're fortunate as Emiratis to have a very generous government where we are sponsored to go study abroad, as you must be very much aware. There's a good portion of Emirati nationals who go and study medicine every year. I don't know, 10, 20, 30, maybe 50, but only a handful really come back. I know of many friends, I know many relatives who go and study for 10, 12, 14 years or so abroad, whether it be in Canada, whether it be in the US or Australia, they don't want to come back. And when you ask them why, the answer is, well, I don't have a career to come back to, a career that is that is competitive with what I would otherwise get in the US or Europe, for example. And that is also research and knowledge driven. It's one thing to say, great, I'll come back, I'll work in an institution, I'll go treat patients, I'll do surgeries on a daily basis, but to continuously learn, to dialogue with a network of global experts is something that we need to start to offer. And we've begun to do that on a very small scale on some of our initiatives, but we want to continue to foster that and to encourage that on an ongoing basis. Absolutely, when we attract our partners, there's a clear understanding between us that over the coming 10, 15, 20 years, which is why we partner up on such long-term basis, is that knowledge needs to be transferred to a more local and maybe more realistic or regional community, perhaps to also attract some of those Western-educated Arab origin nationals to come closer to home. And this could be a place to start. And we're beginning to see that. An example is, I mean, if we look at the profile of some of the individuals who've begun to show interest ahead of the opening of our Cleveland Clinic Abu Dhabi Hospital, there's a tremendous amount of individuals that come from this region who want to come. There are Emiratis who are calling me personally or calling the Cleveland Clinic staff who are already on ground, asking about when the opening is and how can I get involved into this. That's a great change in mentality. Within our diabetes center, we have quite a few Arab origin nationals. We actually have, we do have a couple of UAE nationals who are medical professionals there. And what has attracted them to there is the fact that not only they can practice in a reputable institution, but they have weekly educational seminars via technology back with London, Imperial College London, sharing complex cases, sharing information and knowledge. Also having access to identifying potential research programs for down the line. So the short answer to your question is that yes, we do have an ambition, but the answer to having exact numbers, we just don't have. But naturally, we do sense that by conducting these efforts and further collaboration between public and private sector will only cater to attracting these people much more easily, but at the same time to start to educate our population, especially the younger generations, that the healthcare industry is one that is that one can have a very successful career within, the way we did with engineering 20, 30 years ago. I mean, at that point in time, probably majority of Emirati nationals aspire to become some sort of engineer or the other with the ambition to come and work in ADNOC. And that mentality should be trickled down to other sectors and the ADNOCs of the various industries.
May I have one final question, Vijay?
Sure. That's great. Thank you. Vijay Vaidiswaran with The Economist. Question about actually looking at the perspective of the patient. And sometimes the doctors on the panel will know patients don't behave the way they should. And when it comes to chronic diseases, one of the great challenges is changing behavior. How do you get patients to take pills on time or to manage their diabetes in the particular problem that you have? Anything that people are trying around the world, technologies, text messaging, incentive programs with lower deductibles. Can you give a quick snapshot, anyone on the panel who wants to tackle this, as to how you look at this problem of changing individual behavior?
Sure. I can give that a try. That's okay with my colleagues. Absolutely. I think from your perspective, to be critical. What we've learned is that it's education, education, education. Informing the patient on an ongoing and daily basis how important it is to follow a prescribed regimen has been key in having them follow a particular path. Knowing that the patient, when the patient knows that, you know what, I came to the diabetes center today, I'm going to have to come back next month, I'm going to have to come back the month after, and this doctor is going to monitor my progress by telephone, by future of text messaging or remote health monitoring, and et cetera, this individual feels responsible. The more they're educated, the more responsible they feel towards following a certain regimen. But at the end of the day, it boils down to pure human nature from our experience, and that is, if you know the importance of how what it takes to follow a particular regimen, you just do. I mean, you're going to live healthier, and it comes by demonstration. I mean, you follow it, you feel healthier, you pass the message to others, others will follow the same. The word of mouth is probably the strongest form of communication in this part of the world, as is probably others too. And we've learned that actually does take place. Tying that to incentives on deductibles, et cetera, that would be in an ideal world and a great place to get to, and perhaps a future of where we're heading over here. And perhaps that's something Dr. Goldner can comment on. But from our perspective, in a very basic sense, and keep it very humble, that is where we are today.
In our own example, I'm just telling you our hospital, we used to have only 30 angioplasty per month. As on today, 180. That means the confidence level increased because highly qualified doctors have come. When the confidence is increased by the doctors, they will come automatically. And you see, all these 180 people would have gone somewhere else. In spite of their health authority, Heart Hospital also is increasing. So quality of doctors like Cleveland, SKMC, all these people have contributed a lot for this.
I think from a different tack of what's out there now is this is a ripe area for innovation. This is where, if you look at obesity or diabetes and the intersection between human behavior, and maybe it's not even really a healthcare, or maybe it's wrong to make it a medical problem, but you bring people together to look at it, behavioralists, the medical doctors, and patients themselves, and really try and tackle and get to the root causes. And maybe it's, I know Rick doesn't like the term, but personalized medicine, where you're looking at the genetic makeup, and maybe it's not just one disease or one problem, but it's for an individual. So I think it's ripe. It's a huge market. Maybe you get Babson College working on it over here. I think this in a way, Abu Dhabi is a perfect a place for innovation, where you have these great universities coming together. You've got this education system that's starting to turn out exciting things. There's no borders to knowledge. You've got the health system that's ready to embrace change. So it's really a wonderful place to develop those types of strategies that are going to work and then export to the rest of the world.
That's great. If I may just add on all the wonderful things that people said. I think the short answer is the hardest problem is the one that we need to address. It's the place to address it here, because we do have the data infrastructure, but we don't know what works, and that's why I would say we need true risk transfer, and we need a payment system that says, whatever works, whether it's the Bengali telephone consultation or the video games or the local personal coach, whatever you prefer, correct? We pay you for the results. But that's where I also think that Abu Dhabi really is unique. Right. We follow people through inpatient, outpatient space, private, public sector, same rules apply, all the data gets collected in one spot, so we actually do have the risk metrics to actually measure whether you do make a difference and whether things work. And I think without that, without having, a payment system that ties it to things that truly works, it will be, difficult. But that's innovation. That's exactly. truly where we want to be. And it doesn't have to be medicine. It can be computer games.
Well, this has been great. I want to thank our eminent panel and the terrific questions. I think we ended on exactly the right note. And in fact, innovation is about solving problems. It doesn't have to be high technology. It can be high technology. It is about being willing to solve problems to achieve something, and Vijay put his finger on what often is the rate-limiting step. So once again, let's thank our panel.